What common question related tuberculosis? 1. What exactly is TB? Mycobacterium tuberculosis is the bacterium that causes the disease known as tuberculosis. Although TB most frequently affects the lungs, it can also affect the brain, lymph nodes, kidneys, bones, joints, larynx, intestines, or eyes. TB infection and TB disease are consequently two TB-related conditions. TB is referred to as extrapulmonary TB when it is discovered outside the lungs. 2. What distinguishes tuberculosis disease from tuberculosis infection? There are typically two stages of TB infection, one in which the bacteria can spread and cause disease, and the other in which the bacteria are present within an individual's body but are not contagious and cannot be spread. Although TB bacteria are present in the bodies of people with TB infection, the bacteria are not active, so the individuals are not ill. These people cannot transmit the bacteria to others because they do not exhibit TB disease symptoms. They might eventually get TB disease, though. To keep them from contracting TB disease, they have frequently prescribed treatment. People who have TB disease are ill from TB bacteria that are active, which means that they are growing and degrading their body's tissue. They typically exhibit TB disease symptoms. People who have TB disease in their throat or lungs have the potential to infect others. Drugs for the treatment of TB disease are prescribed to them. 3. Who's susceptible to tuberculosis? People who are at high risk for contracting TB include those who have had frequent close contact with someone who has the disease, immigrated from or spent a lot of time in a nation with a high rate of TB, are homeless, inject drugs, have HIV infection, live in crowded environments, and/or have a medical condition that impairs immunity. In general, 5 to 10% of infected individuals who do not receive treatment for TB infection will eventually develop TB disease. That risk is significantly higher for people with impaired immune systems than for those with healthy immune systems. 4. What tuberculosis signs and symptoms are there? Those who have TB infection do not feel ill and show no symptoms. Depending on where in the body the TB bacteria are growing, people who contract TB disease exhibit different symptoms. TB symptoms can include a bad cough that lasts 3 weeks or longer, chest pain, coughing up blood or sputum, weakness/fatigue, weight loss, chills, fever, and night sweats. TB bacteria typically grow in the lungs. 5. How soon after infection do symptoms start to show? 8 to 10 weeks after the initial infection, people can be tested to see if they have a TB infection. Only having a TB infection, a person is unlikely to exhibit any symptoms. People who are infected may or may not develop TB disease over the course of their lifetime. There is no set period of time during which this occurs. Instead, it depends on other medical issues a person may have, which may impair their immune systems and encourage the development of TB disease. Before their immune system has a chance to combat the TB bacteria, some people contract TB disease quickly, within a few weeks, after contracting the infection. When their immune systems deteriorate for another reason, other people may contract a disease years down the road. Many individuals who contract TB never develop the disease. 6. How does the disease spread? Airborne transmission of the tuberculosis-causing bacteria. The bacteria are spread into the air when a person with TB disease coughs, sneezes, speaks, or sings. Depending on the environment, the bacteria can linger in the air for a number of hours. Normally, infection with tuberculosis requires prolonged exposure to the disease. People who have TB infection cannot spread it to others. 7. How long does tuberculosis infection last? A person who has TB disease may continue to be contagious until they have received the proper treatment for a number of weeks. Because there are no TB bacteria in the sputum, a person with TB infection but no disease cannot transmit the infection to others. 8. How is tuberculosis discovered in a patient? The TB skin test, TST, and TB blood tests are the two types of tests used to find TB in the body. A TB skin test or TB blood test result only indicates that a person has had TB bacterial infection. To determine whether someone is merely infected or has developed TB disease, additional tests are required. A sputum sample, a chest X-ray or CT scan, and a diagnosis of TB disease are required.